loud, speaking out. It's about cognition. We work on a lot of the memory, brain cognition techniques, but it works those muscles you need for swallowing. My mom had Parkinson's for 30 years, and swallowing pills and her favorite steak and salad and red velvet cake birthday dinner became very difficult process, but the therapies really helped. HealthFit Gym, which is also owned and operated by Sarasota Memorial, has a whole series of exercise classes outside of where you need an insurance card and a therapist. They do a class called Big Strides with Exercise, and they do whopping movers, and we have medical massage, warm water therapy, yoga, tai chi, rock steady boxing. For exercise, anything that's a high cardio and a good left-right seems to be the best combination, like the pedaling. We have that as well, pedaling, boxing, whopping movers, all of those exercise classes as well. So besides support group, education, exercise classes, and therapies, in a good neurologist, you got a great start. The other place for a lot of wonderful information, totally free, is the Neuro Challenge Foundation for Parkinson's. And they will set you up with a one-on-one appointment with a care advisor who is filled in on everything happening in the county, north and south of us as well. And they can really drill down on a one-on-one basis and help you connect with services right near you.
Oh, that's awesome. Wow, it's really exciting to hear. We have a friend of ours here that has the onsets of Parkinson's. We've actually done a show with her. And one thing that she found it to help with was the tremors. Any of the patients that you have that have gotten on product, have you heard that from any of them?
You mean with the CBD oils in specific? Or with the therapies?
With the therapy and possibly an additive of like CBD, or both, or one or the other?
Well, the tremors are immensely helped with that right-left high cardio. So pedaling classes, rowing, boxing, whopping movers, LSVT big, anything that does the left-right really helps with the tremors. Of course, the Parkinson medications, the carbidopa, levodopas, like the Cinemet, that put that dopamine that you're missing with Parkinson's. That's a good medical option for the tremors as well as we offer DBS surgery, which is deep brainstem stimulation surgery, where they implant a device. And for some, there's stipulations on who that actually works for. That is a wonderful option for tremors. So those are the big ones that we offer with tremors, is those like classes, the therapies, the surgeries, and the medications with the neurologist.
Wow, that's great.
Now, of course, with tremors, you get a lot of rigidity and stiffness. So that's where I can see where a cream would help, as well as massage, stretching, hot tub warm water therapy, anything that we can do to relieve that rigidity of muscle that comes with Parkinson's.
So that would be one of the places where possibly if your doctor approved a topical cream could work to try to release the tension from those receptors in the localized areas.
Yep. And the other part with the creams is, there's a lot of mood issues with Parkinson's because of that lower dose of dopamine. I know for my mom, I'd walk in to see her and she'd just be crying and crying, and my little heart would be breaking. And I'd say, "Mom, what's wrong? Why are you crying?" And she'd say, "I don't know." But along with that kind of it's somewhat depression, but she didn't even know there's an anxiety that comes with it. There's a lot of apathy. All these great programs I just listed, if the apathy is there, they don't have any desire to go to them, then it's kind of a vicious cycle where things could help, but they don't feel like doing it. And I know that the creams have been shown, at least by the patients we here in support groups, to reduce some of that anxiety and also, reduce some of that blood pressure response to the stress that they're feeling when they're frozen in the middle of a room and can't get their legs moving. So, sleep, mood, anxiety, rigidity in muscles, I think those are the places that I've actually heard our patients talking about it.
Oh, nice. So we have a couple minutes left here, and what would you say would be important for a patient if they were looking into like a CBD product? Number one would be talking to their doctor. And what do you think else would be, what else do you think would be important about like the products itself?
Boy, I guess that's not my forte. That's your expertise. Yes, absolutely. The doctor and pharmaceuticals, making sure we know what else they're taking, because it's not just Parkinson's meds. It could be, blood thinners that they could be taking. And I don't have a whole list of all the possibilities, even if they're taking a leave. But so the interactions. But then always with anything new, once you've crossed those two paths, is to start slow. Try little, try it, see how things affect you. You don't want to end up with, more exhaustion or more bowel problems or something. So, always use it starting slow, and use it in conjunction with other holistic methods such as exercise and massage and rehab therapies. For Parkinson's, it's not ever just one magic pill, one magic exercise. It's trial and error, and it can change from week to week.
Yeah. Yeah. It's been so interesting in the journey of learning about Parkinson's and the different parts of it. And it definitely a lot of different pieces to it. And
oh yeah, it affects vision. I mean, we have vision therapy. We recommend a neuro-ophthalmologist. It has sleep issues, speech issues, balance. Driving is a huge issue between the vision and, lower reaction times and multitasking. And of course, anytime you take another medication, you got to reevaluate that as well. So there's a lot of components. That's why I would say check out the educations, listen to others in support groups, make an appointment with a care advisor at Neuro Challenge. But the more informed you are, the better choices you can make.
Awesome. Awesome. Yeah, and some of the things that we've seen with like our water soluble product, which is the most bioavailable, it gets to the brain barrier in like 5 to 7 minutes, is mood stability, focusing, less anxiety. And then we've noticed with like the oil, some of our customers find that they sleep better. So that product, when it's sublingual, it does stay in the body a little bit longer. So it kind of works while you're sleeping. And also with pain management and things like that. So definitely.
Well, I know with their Parkinson meds, they can't take it with a protein because it affects a lot of the efficacy of the drugs. And that might or might not be similar with some of the CBDs who have they have that one enzyme that breaks it down too quickly so that the medications aren't absorbed as well. So sometimes it's a matter of timing, an hour before, an hour after. Again, that's where the expertise of physicians come in.
Yes. Yeah, that's awesome. Well, Wanda, thank you so much for joining us. It seems like we have so much more to go over, and we may add a part 2 to this, so you guys stay tuned because there's so much to talk about. And I know there's so many people out there searching for something different than what they're doing, but I feel like something important was how you combined all these with the exercise, the massage, the groups, being involved with the communities of others that are going through what you're going through to talk about the big, the loud, the speak out programs. So thank you for all that you do for our community, and thank you for your time. And listeners, we will continue on a part 2 for this. And thank you so much, and we'll see you guys soon.